Good evening, student. In last lecture, we studied about the sensation and attention during the physical mode of classes. Today, we are going to discuss about, in continuation with the sensation and attention, important topic, that is nothing but the perception. So, perception, it is related to the topic, that is nothing but the sensation and the attention. And when we are talking about the perception, it is sensing the things through your sense organ, and after that you are going to interpret, and after the interpretation you are going to correlate with your past experiences, and after that you are going to perceive the stimuli. So that is nothing but the perception. So in detail today we are going to learn about the perception. So when we are talking about the perception. Perception is a process through which we become aware of our characteristic and those of our environment through the functioning of our sense organ. So in simple way, through the sense organ we are going to perceive the stimuli, or we are going to know regarding the stimuli, or know regarding what kind of the environmental stimuli it is. After that, through your past experiences you are going to interpret, and after that you are going to realize actually what kind of the stimuli it is. So if I am giving the example, sugar. So sugar, you are going to taste the sugar, after that you are going to come to the conclusion that it is a sweet. So in your lifespan you might be tasted the sugar, and your taste bud, they know regarding your this sugar is sweet, and when next time when you are taking the sugar, the taste bud, they will going to recognize it is a sweet one, and it will going to correlate with your past experiences, it is a sugar. So final perception, that is nothing but the sugar is a sweet, and you will going to test it. After the testing you will going to perceive that whatever the things you have taken in your mouth, and you have tested it, and finally you are coming to the conclusion it is a sugar. So this whole process, that taking the stimuli, then in what you can say, judging the stimuli, after that the interpretation of the stimuli, and after that you are coming to the conclusion it is a sweet. So that is whole process after the interpretation, that is nothing but the perception. Then this perception, it will going to differ from individual to individual, or there may be the some bias may going to take place when you are perceiving the things. So it is sometimes it is maybe going to differ from the reality, or many times there will be the what you can say, some environmental factors might be present in the environment that will going to alter the perception, or misinterpretation of the perception may going to take place. So in the figure or the diagram you may be able to see the figure of the two individuals. They are perceiving the first perceiving it is as a 6, and another is perceiving as a 9. So this may, from which side you are observing it, that may making the difference in perception. So these are the what you can say, different type of the what you can say, illusions, or different type the mistaken of the perception may going to occur. So normally it is present on your environment. What type of the environment, or the some environmental abnormalities, or environmental some factors might be present that may lead to the misleadings of the perception. Then we are going to see the factors that affect the perception. So there are the various factors that they are affecting the perception. So in that first one, that is nothing but the sense organ. That is also the important one. All your sense organ, they should not be impaired one. They should be properly functioning should be there. Then there is a brain. Then the past experiences, learning process, emotions, acquired interests, motives. Then our self philosophy or the self concept, then our expectations, that also going to alter the, or they may going to affect the on our perception. So in detail we are going to discuss all these things. So first of all, sense organ. If our sense organ they are not patent one, they are not what you can say, they are, if they are not functioning properly, then also you are not able to perceive the things properly. I will going to give the one example. In fever, we will going to have the coated tongue. So in the coated tongue, always we are complaining, I don't have the taste of any food. So in the fever, normal there will be the coating of the tongue will be there, and due to the coating of the tongue, you are not able to taste the object properly. Then in the same manner, if there is a problem of the hearing organ will be there, you are not able to hear the properly. In the what you can say respiratory tract infection, if you are having the infection of the respiratory tract, in that you are not, you are due to the packing of the nose, you are not able to smell the things properly. So these are the factor. If your sense organ they are impaired one, you are not able to perceive the things properly. There will be the alteration will be there, or it playing the important role in the misinterpretation of the stimuli. Then the brain, if your brain is functioning properly, then you are able to perceive the things in the proper manner. So already we studied in our previous lectures. If you are going to study about the brain, there are the mainly the four lobes. Frontal lobe will be there, parietal lobe will be there, occipital will be there, and the temporal lobe will be there. So all these lobes, they are having the different types of the function, or in the different lobe, different type of the sensory input they will be analyzed, and as per that we will going to take the action. Suppose I am going to take the example frontal lobe. The frontal lobe mainly deals with the our joint movement will be there, or it will going to help in the language production. Suppose this frontal lobe it is affected, then we are not able to perceive the things properly, mainly related to the movement thing. Then if you are going to take the another example, that is nothing but the parietal lobe. Mainly all the type of the somatosensory input, they are analyzed and interpreted by the parietal lobe, except olfaction. So there will be a touch will be there, pressure will be there. So all type, if somebody is touching you, that you are going to perceive what kind of touch it is. That may be the what you can say, that touch may be the therapeutic touch. The touch may be related to what you can say pressing of the body organ will be there. So that normally it will be analyzed in the parietal lobe. If parietal lobe is damaged one, you are not able to perceive the touch or the pressure in the proper manner, or the temperature like thing, that you will not be able to interpret properly, or you are not able to perceive properly. So your brain should be function normally, then only the perception will go into in the normal manner. Otherwise it will go into that misinterpretation may be there, or you are not able to perceive in the proper manner. Then your past experience, already I quoted the example in the beginning. When you are anything that you are going to see the first time, you are not able, you are what you can say learning that particular things, and when this same situation is occurring in your lifespan again, then whatever your past experience you are going to correlate with the previous thing, and finally you are able to interpret the things and coming to the proper conclusion. So your past experiences and your past learning, that is playing the important role in the interpretation of the stimuli and the proper perception of the different kind of the stimuli. That may be related to hearing, that may be related to the vision, that may be related to the any past event, or the smelling will be there, pressure will be there, touch will be there. So different type of the stimuli you are able to interpret in the proper way. If it is happening in your past, then you will go into present with the correlate with the present, and then you are coming to the final conclusion. That is nothing but you are perceiving in the proper manner. Then our emotions, that also playing the important role in the perception, and our acquired interest. Suppose you are happy, then you will going to perceive the things in the what you can say positive way. If you are the what you can say sad, or you are angry, or you are frustrated, then whatever the things happening with you, you will going to perceive in the negative way. So negative attitude formation towards the particular thing or the particular stimuli, or the positive attitude formation towards the any stimuli, that the emotions also playing the important role in the perception of the things. Suppose I will give the example. Suppose any lady is there and her son that is died due to the dog bite. So she having very bad emotion towards the dog bite. When she will going to see the dog on a street also, she will going to correlate that due to this dog my son was died. Then she having very bad interpretation about the dog or the perception regarding the dog. Then our acquired interest, in which area we are interested, in that also the playing the important role in the perception of the various type of the stimuli. Suppose you are interested in the TV watching, then when you are going to see or your interest, your hobby is what you can say acting. So whenever you will going to watch the movie, you will going to correlate yourself with the particular, that I am the what you can say particular hero of the particular movies. So your acquired interest, that is what you can say playing, or the what you can what you can say in directly proportional when you are watching the particular cinema on the television, or you are going to put yourself in the particular role, because that is related to your acquired interest, or you are what you can say want your acquired interest, you want to become a TV actor. So normally our acquired interest always help what you can say playing important role in the perception or in the interpretation of the stimuli. Then expectation, our fathers or our parents expectation, that also playing the important role in the formation of our perception. If they are want to, our child always should become a doctor, or what you can say our child he should become an engineer. So this expectation also playing the important role. What we expect, in the same manner we will going to perceive the things. Suppose you scored the marks, that is 90% marks, but that is not fulfilling your parents' dream. So they will not going to become happy, or they want that you should score the more marks, then only you become the what kind of doctor or whatever their dreams. So always our expectation, they are always affecting the perception. So perception of the marks, always that perception they want always mark that is in the high score marks, that always correlating with their expectation, that is their award, that he should become a doctor or he should become the engineer. Then our self concept or our philosophy, or our self concept is a positive, always we will going to have the positive type of the perception. If our self concept is always negative, always we are finding the fact finding attitude if we are having, then always it will going to alter the things, or it will going to playing the formation of the negative attitude or the positive attitude. That is normally depend on our philosophy, or that is depend on our self concept. Then important part of the perception, that is nothing but the principles of perception, that we will going to deal in detail. So in that three important principle, that is nothing but the perception is a selective one, perception is a process of the supplementing one, then perception is organizing activity. So normally in the perception is the organized activity, there will be sub principles will be there. So all that we will going to see in detail. So first one, that is nothing but the perception is the selective one. Suppose you are in the classroom and teacher is teaching the particular class, then what happens, you will going to attend the class of your teacher only, because your perception is a selective one. Then you will not going to attend the other activity that is happening around you, because other impulses they are the blocked one, and only you will going to perceive the lecture or whatever the class is going on. So that is nothing but the other impulses you will going to block. Only the selective impulses or the selective stimuli you will going to attain, and that is already we learned, that is a what you can say role of the thalamus. So thalamus is playing the important role in the selective perception. Then perception is a process of the supplementing. Suppose you in your life's time you know the railway and you heard the noise of the railway. So when you are hearing the sound of this railway, the railway is not in your visual field, but then also that is come in front of you by only the sound of the railway or the only the horn of railway. That railway is approaching towards you. Means what happens over here, the sound or the horn of railway, it is supplementing to the perception that a train is coming. So the many times this perception is a process of supplementing. So over here noise or the sound of railway or the horn of railways, that gives a picture of it will going to perceive that railway is coming. So that is nothing but the perception is a process of supplementing. The next one, perception is a organizing activity. So normally over here we will going to learn in detail about various sub-principles. We will going to organize our stimuli and we will going to perceive as a whole. So there are the different principles that we will going to see. In that first one, figure and ground relationship. When you are going to see this whatever the picture, that you are going to perceive in the different manner. Only if you are going to see about the figure, so there will be the what you can say clock is there, and that you are going to perceive it in the black background or the black figure. But when you are going to give the attention towards the ground, that is nothing but the white area, you will going to perceive that there are the two faces. They are approaching or they are seeing towards each other, and this ground also. So in the simple way, the ground and the figure, if they are in the contrast, the whatever the color that is the most catchy one, you will going to give the attention to the first. But when you are giving the attention to the ground, you are able to interpret there are the different scenario that is apart from the actual figure. So that is nothing but the figure ground relationship in the perception. The next principle, that is nothing but the proximity. So in the proximity, in the figure A, you are able to see there are the dotted lines. So when I ask how many dotted lines, you are going to perceive there are the three pairs of the dotted line. You will not going to perceive there are the 6 separate lines. So this is nothing but the whatever the things they are closure, you will going to perceive as a whole, or the things which are proximal one, you will going to perceive as a together one. Then the second principle, that is nothing but the similarity. So there are the lines of the what you can say there are the dots, that is yellow dots and the red dots. So you will going to perceive, because those who are looking similar, you will going to group them as a together one. So you will going to perceive there are the 3 lines of the yellow dot and there are the 3 lines of the red dots. You will not going to perceive there are the 4 lines of the yellow and the red dot. So that is nothing, whatever the things they are looking similar, you will going to group them together. Then the next principle, that is nothing but the principles of continuity. So in the figure C, you are able to see the 2 lines, that is nothing but the first line, that is 1 to 2, and second line, that is nothing but the 3 to 4, because they are continuous. That's why you are saying, though that is interrupted by each other, then also you are perceiving that they are the separate one. That is the first line, that is 1 to 2, and second line, that is nothing but the 3 to 4. Though it is interrupted by each other, but then also you are going to perceive as a continuous only. Then next principle, that is nothing but the closure. So that there are the some dots, but they are in the some what you can say some organized manner, and that is you are correlating with your past experience. So in your lifespan you might be saw the horse, so that dots they are in the same manner, so you are going to perceive you are not going to perceive as a dot, you are going to perceive as a horse. So over here also the what you can say principle of the closure. So there are the what you can say different figures are there, but you are not going to perceive as a separate one, but you are going to use the principle, that is nothing but the closure. So there are in the first figure there are the three dots, you are going to perceive as a triangle one, and there are the knob on the different sides of the triangle. In the second you are going to perceive as a football. Then the what you can say in the third figure you are going to perceive as a things, that is it is correlated with the panda, but it is an actual dot, but that dot in the closure manner it is given the figure of the panda, so you are going to perceive it is as a panda. Then the next figure, that is a word that is incomplete, though it is interrupted in between, but then also you are able to read that is this word is a incomplete word. Then we will going to see about the monocular cubes, or it is also called as a perception of the depth and the distance, or it is also called as the monocular cubes and the binocular cubes. So these are the what you can say giving the perception about the depth and the distance. So in that there are the different cues, monocular cubes and the binocular cube, that is nothing but the relative size, interposition, shadow, linear perspectivities, then the retina disparity and the convergence. So these monocular cubes and the binocular cubes we will going to see in detail. So relative size, so in the first figure you are able to see the two bottles. So the bottles are the what you can say the bottles which is close to you, that you are going to perceive as a big one, and the bottle which is far from you you are going to perceive as a small one, though you know they are same in the height, same in the weight, same in the color, but the things which are closer you are going to perceive as a large one. Same things you are going to see in the next figure. There are the two trees, they are in the similar size, but the tree which is closer you are going to perceive as a big one, or the things which are closer to you you are going to perceive as a big one, though you know their size is a normal one, but only things you are visualizing them from the far distance or from the long distance. Then interposition, there are in the first figure there are the two square, the red square and the blue square, but the square which is in front, so red square is in front of the blue, or this red one is hiding the blue one, so you are able to perceive, though they are the similar size, but red you will going to perceive at the larger size and the blue you will going to perceive as a smaller size. In the same manner there are the two triangle, the green triangle and the red triangle. So this red is hidden by the what you can say, or this green triangle is hiding the red one. So whatever the triangle which is close to you, that you will going to perceive as a big one, and whatever the triangle that is behind you will going to perceive as a small one. Then the principle of linear perspectivities. Suppose there are the two parallel lines and they are going parallel to each other, but when they are going in the long distance, when you are going to see from the long distance, these two lines they are meeting to each other, so or whatever the distance between two lines, slowly it will going to decrease down. In actual it is there is a whatever the distance that will be similar at all the points, but when it is for the longer duration, or you are watching from the longer duration or longer distance, you are going to perceive they are meeting to each other when it is going at a long distance. So that is called the linear principle of linear perspective. Then shadow. So normally shadow, it is shadow of a small size or the shadow of the big size. That will depend on from which side there is a light projection is there. So normally length of the shadow, that will going to depend on the what you can say light projection, but by that you are not interpreting there is a alteration in the size of the person. So sometimes it will going to play the what you can say, it is going to alter, but your learning is proper one, your past experience is proper one, your what you can say monocular cube is proper one, you are going to perceive normally the things actually what you are seeing. So shadow, if it is a big one, it is nothing but the whatever actual figure, that is a big one. So you will going to correlate, interpret it is a shadow, in which way the light projection is there, and as per that you will going to perceive the things. Then retina disparity. So there are the two figures, but when you are able to see from the left eye, you are going to see the different position. When you are going to see from the right eye, you are going to see in the different position. So you can judge by this thing, when by closing the one eye and watch, suppose you are closing the right eye, watch from the left eye, and the same things you close vice versa, you close the left eye and see the things from the right eye, there will be the change in the what you can say position of the object normal, that is due to the retinal disparity. So there are the what you can say, whatever the image in the both the eyes, that will going to produce on the, or that will going to what you can say produce on the retina at the different size, or the different what you can say the level will be there, and that is due to the retinal disparity. If the retinal disparity in the both the eye, if it is more, then it will go into whatever things that you will going to see the things more closer. If the retinal disparity is normal one, then you will going to see the things at the normal distance, or at the normal length, or at the normal height. Then the principle of the conversion. So normally conversion, when you have to convert the things in the vertical, there are the different type of the stimuli is there, and you want to see the things at a once, or different stimuli you want to see at a once. There is a what you can see, you are converting the things, or you are whatever stimuli you are bringing them at the some point, that is nothing but the conversion. So normally for the conversion there will be the what you can say eye movement that will come to the what you can say at the medial side. So that is nothing but the conversion. Then we will going to see about the next concept, that is nothing but the perceptual constancy, or whatever the object of the same size. Suppose you are watching the ST bus from the mountain, you are going to see the in the very small size, but you know the actual size of the ST. So though it is looking small, but you know the what is actual size of the particular bus. So that concept, that is nothing but the perceptual constancy. So in this we will going to learn about the size constancy, shape constancy, and the color constancy. So when we are talking about the size constancy, normally the things which is closer, that is looking big, but it doesn't mean the things which is what you can say similar things which is far away, that is small things. Normally you will going to perceive of a same size. So if it is a far, or if it is a closer, in your brain the image of this things in the similar manner, means it is in the constant manner, it will not going to alter though it is close to you or though it is far from you. Next, shape constancy. So in this you are able to watch from the different angle, but you know the actual shape of the watch. So in the one direction you are going to see in the oval shape, in the another direction you are going to see the clear circle shape. So you know, so whatever the watch you are observing, it is a circular in shape, though you are able to see from the different angles. So that is nothing but the shape of the things that will going to remain constant one, it will not going to alter though you are looking from the different angle. Then the color constancy. Color constancy means normally when you are able to see about the apple, so typical color of the apple that you will going to see, or you will go into that mental image that will going to produce in your mind. The next perception, that is nothing but the perception related to the motion. So there are the two types of motion will be there. That is nothing but the real motion, and second one, that is nothing but the apparent motion. So when you are talking about the real motion, that is the movement of the objects around us, that is nothing but the real motion, and or whatever the movement of ourselves, that is nothing but the real motion. But when you are talking about the apparent motion, there is a what you can say illusion of the motion will be there, or the misinterpretation of the movement will be there. So that is nothing but the apparent motion. So there are the different kinds of the apparent motion of the illusions, or the misinterpretation of the stimuli that we are going to see in the what you can say afterwards. So they are the mainly the autokinetic effect one, stroboscopic motion will be there, and the induced movement will be there. So this we are going to see in detail. So when you are talking about the autokinetic effect, so normally in the dark you are putting your point of your battery, or the focus of the battery on the wall, though it is what you can say fixed one, but then also you will be able to see that whatever the projection, that is the moving one. So that is nothing but the autokinetic effect. So whatever the constant drop or focus of the light that on the wall, it is a fixed one, but then also you are able to see it is a moving one. That effect, it is called as the autokinetic effect. Then next one, that is nothing but the stroboscopic motion. So normally if you are able to see the more number of pictures one after the another, then we will be able to correlate that it is a movement is happening. So best example of it, that is nothing but what I can say movie. So movie, if you are going to see the film of the movie, there are the discrete pictures, but when it is what you can say coming in the fast manner one after the another, the motion picture or the movement that you will going to watch, so that is nothing but the stroboscopic motion. Then next one is that is the induced movement. So induced movement means same example about the autokinetic one. So if you are what you can say environment, or the whatever the background, if it is a moving, then also the focus or the light focus, that there will be the change in the what you can say its projection that we will going to see. So the normally the projection or the whatever the stimuli, that is the constant one, but due to the environmental changes you will going to find the movement. So that is nothing but there is a stimuli, but you will going to misinterpret due to the external environmental factor. So that is called as apparent motion, and normally it is autokinetic type, stroboscopic, and the induced movement. Then we will going to see about the errors of perception. Normally there are the different types of the errors in the perception. In that the first one, that is nothing but the illusions. So illusion, that is nothing but the what you can say wrong perception of the stimuli. Wrong perception of the stimuli. So stimuli is there, but you are perceiving it is wrongly. Suppose in the dark some paper is there on the ground, and due to the wind the movement is there. So that paper, or the sometimes there is a rope on the ground, and that rope you are going to perceive as a snake one. So that is nothing but the illusion. So stimuli is there, rope is there, but you are misinterpreting. Your rope you are perceiving as a snake one. So that is nothing but the illusion. In the same manner, in the figure there are the one arrow, that point is inward, and the second arrow, that is the point is outward. So the first you will going to, as compared to first side length of the second one, that is a more one, because whatever the tip of arrow, that is the outward projection is there. So due to the outward projection, you will going to perceive that length of the particular arrow is a more one. Then in the second one there is a perpendicular line, and there is what you can say horizontal line. So you are going to perceive the horizontal object as a taller one, as or the length is a more as compared to the horizontal one, because maximum time we are going to give the attention to the vertical things rather than the horizontal, though they are the same in the length. Then the hallucination. So hallucination, it is a psychiatric disorder. So there is no any, what you can say, stimuli. So in the absence of the stimuli, you are perceiving the things. So that is nothing but the, what you can say, hallucination. So normally the psychiatric patient, they are going to have the different type of hallucination. That may be the visual hallucination, that may be the auditory hallucination, that may be the kinesthetic hallucination will be there. So, but they, what it is different, getting different from the illusion. In the illusion there is stimuli, but misinterpretation of the stimuli will be. But in the hallucination there is no any stimuli, but then also you are perceiving the things. Normally there is a alteration in the neurotransmitter level that leads to the formation of the hallucination, and normally it is typical sign of the various psychiatric disorder, mainly the schizophrenia or the psychosis. Then factors responsible for optical illusions or misinterpretation of stimuli, that we are going to see. What are the different factors? Due to that the person is not able to perceive the stimuli in the proper manner. So in that first one, greater effort required to follow the vertical line than the horizontal line, that already we said. So we are giving maximum attention to the vertical line rather than the horizontal one. Or the things which are in front of you, you will give the maximum attention rather than the what is the background or the what is the, what you can say, base of the particular things. The illusion occurs if the eye movements are blocked or disturbed, or if there is what you can say, errors in the vision, if it is present, then also the illusion will going to take place. Then background of the object, it is also playing the important role. So what we earlier we saw regarding the figure ground relationship. So background also playing the important role in the formation of the illusion. The relevance of attention and perception for the nurses. Why it is important one for the nurses? So if your stimuli or your past experience, or you are able to give the proper attention and you are able to perceive the things, then it helps for the accurate observation. Then where we have to give the extra attention, that also playing the important role. Suppose if you are giving the administrating a drug, so you are going to see the extra attention to the dose of the drug, then the site of giving the drug, so then the expiry. So that is nothing but extra attention to details. Then the avoid distraction. If there is a noise, you should give the what you can say, you should concentrate on your procedure. So block the whatever the stimuli, give the attention to the more important stimuli, and whatever the stimuli that is not important one, block the particular stimuli. Then practice motor and sensory skill. So whenever we require the accuracy, that skill we should practice more time. The nurse must be aware of the principle of normal perception and deals with the abnormal one. So you should know as a nurse what is normal and what is abnormal. So you should be able to discriminate between the illusion and the hallucination. So if any question, you can ask me on WhatsApp, or when our physical classes will be there. During that time we will going to discuss in detail. So thank you. If any question, that we will going to discuss during our physical class, when you are going to commence your classes, during that time we will go to discuss regarding your doubts and all. Thank you.